Now, the United Nations, Kenya and other non-governmental agencies have launched a platform, a kind of what they call a flash appeal, to try and get more funds to help Kenya fight the COVID-19 global pandemic. We're now joined by the resident coordinator in Kenya of the United Nations, Siddharth Chatterjee, to talk us more about this very quickly. Sir, good evening. We understand that you are looking at some 28 billion Kenya shillings. Could you talk to us about that? What informed that figure, and what is priority?
Well, thank you for having me on your program. Today, led by the government of Kenya, the United Nations family, together with the international non-governmental organization and national non-governmental organizations, came together to look at what the critical needs of Kenya are. And what we recognized was that this is a public health crisis, and we have to respond to a public health crisis. It's probably a virus which has the highest velocity and is rather deadly, and we've seen the kind of toll it's taking. So I want to commend, first of all, the Ministry of Health and the government of Kenya in particular for the proactive steps it's taken in terms of the curfew, in terms of the lockdown of several places, in terms of ensuring proper messages on hand washing and physical and safe distancing. But we need a lot more effort, and the collective effort of the United Nations, of 23 UN agencies, funds and programs, have come together looking at what the critical needs on education are, on public health are, on food security and livelihoods are, on protection needs for the refugees and the vulnerable people, orphans and vulnerable children. So we looked at the entire spectrum of social needs, and that's what informed this figure. The UN also has what is known as the UN Development Assistance Framework to Kenya, which covers the period of 2018 to 2022. In fact, if you saw juxtaposed with me today were the ministers of Treasury and the ministers of Devolution, who are the co-chairs of the National Steering Committee of the UNDEF. They asked me as the resident coordinator to look at the UNDEF and look at where we could find resources to be able to respond quickly to this COVID crisis. So from there, we've actually freed up or redeployed about $45 million. So this $267.5 million is essentially life-saving interventions, but at the same time, it's about preserving livelihoods. Over to you, Ben.
All right, just one more question. You've answered my next one about redeploying around 4.6 billion shillings already to Kenya. But about the flash appeal, what timelines are we looking at?
Look, this is urgent, and that is why we've appealed to the international community that this is an appeal unlike any other. This is not a drought, and this is not a flood, and this is perhaps one of the most egregious and dangerous health pandemics we've seen in our lifetimes, and this probably is not the last, but it is a clear indication, and therefore I commend President Kenyatta of having made universal health coverage a priority as part of his Big Four development agenda. I think this appeal needs an urgent response, and at the same time what we need to do, not just locally but globally, is to look at how do we make our health systems robust and really bulletproof it against such pandemics in the future. Over to you, Ben.
Thank you, sir. We thank you for talking to us tonight. Siddharth Chatterjee.